Hi, this is Brent with Mid-America Orthopedics. I'm a physical therapist up in our Kansas City office, and October is physical therapy month, so throughout the month we are going to be highlighting some different conditions that we see in the clinic and giving some tips and strategies on ways of trying to deal with these and trying to improve or prevent some of the conditions. And so today we're going to be discussing kind of IT band irritation, whether it's irritation up at the hip or irritation down at the knee. We know that this time of year there's a lot of races and lots of runners, and so this common condition that we see in runners. A couple different things that we'll see with this, similar to patellofemoral pain irritation, is that we can see some of that kind of collapse of the knee or kind of hip drop, which then ends up loading this IT band. So the IT band is basically a kind of a dense tissue that runs from the ilia or up on kind of the pelvis all the way down to the tibia. And so you can imagine anytime that hip kind of drops down, how that creates some extra tension in there and then can create irritation rather on the outside of the hip or down into the knee. So when we're dealing with this, a lot of times people are doing like foam rolling and trying to kind of loosen it up, and that can help with the symptoms sometimes, but it's really not going to fix the problem. Really the fix is going to be more strengthening up the hip or strengthening up some of those other muscles that are allowing that to collapse down. So a couple of the exercises that we like to do in the clinic, one is just a single leg balance, focusing on keeping that pelvis level. And so if you're loading on that leg and you're allowing it to kind of collapse down, and same thing happens every time you load when you're running, is that it's going to create that irritation. So during this exercise, you're going to be maintaining a good pelvic alignment while you're just doing a little single leg balance, holding for 30 seconds. Doing that 3 to 5 times. That's working on some endurance of these muscles out here on the outside of the hip. Another exercise that we like, it's called the Pretzel. And so on this one, lying on your side, the hip is flexed up to 90, the knee's flexed to 90. You're raising that leg straight up, holding into this external rotation position for a good 10 seconds, and then nice and slow coming back down, and performing about 10 reps on this one. The other important thing with runners is making sure that you're doing some cross training. The issue with running is it's such a straight forward and back motion that you don't end up working these muscles. And so doing some cross training, incorporating some of these exercises, and hopefully this will help with the symptoms. If you have more persistent pain, you might need an evaluation from one of our therapists, rather down in Wichita, or at our office up here in Kansas City. You can call us at 913-232-9846. Thanks for watching.